My name is Maureen Cunningham. I am with the Brain Injury Association of Missouri and Missouri Agribility. This breakout session is Federal Rural Health Programs and Resources. I will be your moderator. A little bit of background or information about the Brain Injury Association and Missouri Agribility. We work with individuals with acquired as well as traumatic brain injuries. And Missouri Agribility works with individuals beyond brain injury, a lot of variety of disabilities that interrupt or make farming and ranching and other agribusinesses helpful. Together, we help create solutions for farmers with disabilities. Specific services of our partnership include information and referral services, looking specifically at modified equipment, also resources to help individuals live a quality life, a quality rural life, with brain injury and other disabilities. We also offer education, agriculture related, and also brain injury related education, along with support groups. We want to make sure that farmers and ranchers continue to enjoy the lifestyle that they have chosen and that they love on the farm. Missouri Agribility, one of our services, is an on-the-farm assessment, literally walking the farm with the farmer to look at risk factors of secondary education and identify possible solutions. It might be modified equipment or modified farming operations. For more information about the Brain Injury Association and Missouri Agribility, you can reach me at staff@biamo.org. It is now time to go ahead and get started with our session. Again, this session is Federal Rural Health Programs and Resources, and it is a breakout session. We have three presenters. Chris Collins is the General Field Representative who assists with telecom, electric, and private companies, as well as local governments with rural utility service programs supporting broadband expansion, distance learning, and telemedicine. With more than 12 years of experience at USDA, Chris assists applicants from the application process through project implementation, bringing much needed services to rural Missouri. Richard Overcast has served as the Deputy Regional Administrator in the Office of Health Resources and Services Administration, HRSA, Office as Regional Operations, ORO, Kansas City Regional Division since September 2020. Richard joined HRSA in 2016 as Public Health Analyst. He served as Kansas and Missouri State Lead, conducting outreach and education throughout Region 7 to increase the reach, impact, and awareness of HRSA programs. Kim Reynolds is the Assistant Regional Administrator for the Substance Abuse and Mental Health Services Administration, SAMHSA, Regional 7. She holds a master's degree in public administration and in adult education. Kim began her career in direct services in community mental health, then went on to oversee programs at several other local and regional nonprofits. While employed at the University of Kansas, she managed SAMHSA and state and private funded behavioral health research and evaluation projects in multiple departments. She has also worked for the state of Kansas in their Medicaid waiver and behavioral health divisions. Most recently, Kim was the single state authority for mental health and substance abuse prevention and treatment. For more than 15 years, she has served on the grant review committees for SAMHSA and the National Institute of Mental Health and other federal state agencies. Please welcome our presenters. You are supposed to clap even in your offices. Chris, would you like to start our panel discussion?
It sounds great, Maureen. Thank you for the introduction, and Melissa, and thank you for having me here at this event, and to bring a real quick overview and discussion about USDA program, especially related to telemedicine. So I'll go ahead and share my screen, and Maureen, if you don't mind, just confirming that this is working.
Yes, we do see it.
Great. You see that all just the presentation, correct? Not the slides. I mean, just the main slide, right? We'll make sure.
We just see the main slide with the
awesome
picture and then the side on the presented by in the sessions.
Great. Thank you, Maureen. Okay. As Maureen said, I am the general field representative with USDA. I'm under the Agency of Rural Utility Service, and this is a real quick overview. A lot of y'all may be familiar with, the USDA programs, rural development, and each state does have a state office, and some of you may be more familiar with the state employees, or with where the state director is at. The difference of what I'm going to talk about today with distance learning telemedicine and any kind of state rural development programs is this is a national level program. I'm actually a national level employee. And so therefore, if you do choose to participate or apply under this program, it will be on a competitive, nationally competitive for this. So my plans for this, and hopefully I will keep with my time, is just give you a quick overview, talk about some eligibilities of the project, the program, give you some resources, and of course, as Maureen mentioned, we'll hold questions and answers to after all the presenters for this session. But hopefully, Melissa, you do have these slides. You're free. Feel free to share them with whomever, after the event. So a snapshot since 2019. Here's some on the left, of course, is what we had available through appropriations for that fiscal year, and then the results on the right. In the most recent year, FY 2021, we are currently still evaluating those applications. I think the deadline for submission was June 4th. And so those are under review. We have about $55 million maybe of appropriations for eligible applications. And currently, all the 274 applications we received, they were requesting upwards of 122 million. So we normally are oversubscribed in this program. I don't want that to discourage anyone because it is a competitive program where a large percentage of the points are objective. You'll know kind of going into it where you're at. And of course, you can always discuss, where you feel you may be as far as competitiveness. And, at the top, so when we talk about funding thresholds, we don't accept applications who are requesting federal grant funds. That's the federal portion, less than 50,000, or if they're requesting more than $1 million federal. And the matching requirement is 15% of the grant request. So if you are asking for $1 million from USDA for your project, that means your overall project would be a $1,150,000 project, where you would support the 150,000. A DLT system to be eligible, it must have a hub and it must have an end user. The purpose of this program, and we'll get into that in later slides, is to get the urban services to the rural areas, or assist rural areas to coordinate or cooperate between each other and possibly share resources. And then we are currently accepting applications. Not currently accepting applications, but we currently only accept applications through grants.gov once an application window is open. We do expect the FY 2022 application period to probably be towards the end of 2021, when I'm saying December, or usually about the first quarter of the following year, which will be 2022. So it is upcoming, potentially. There is rumblings I'm hearing of a potential increase substantial increase of funding for this program. So I do encourage you to look at this. You could even look at last year's application guides and information from last year's funding period. We normally do not change the requirements. We don't change the process too much from year to year. So you could get a substantial start on your project if you wanted to by looking at last year's material. So the purpose of the program is biggest thing is to provide distance learning or telemedicine for the purposes of overcoming remoteness in rural areas. And it could be where, there may be a rural hospital, of course, who cannot afford to have a cardiologist on site or cannot afford to have these specialty doctors on site. And so therefore, the grant could help provide equipment, network uh, funds for network components to link with that specialist from an urban area and provide those services locally. One, keeping your patients local; they don't have to travel. Two, with this, during this pandemic time period, the last thing you want to do is, maybe send one of your patients to an urban area where they may have the higher potential of coming in contact with COVID issues. So, it could be a good way of bringing the services locally and at the same time ensuring the wellness of your patients. So the definition of distance learning, and I want to pause here for a second to since this is mostly with this platform today, we're talking mostly with medical personnel or organizations. I want you to understand you can still, as a medical organization or a healthcare organization, apply as a distance learning project. So if your goal is to say, hey, we want to get put equipment in to allow potentially staff to increase certifications or increase education on site and link with a college or what have you for online courses. Or if you're looking at, with these changing times, there's a lot of training that needs to happen. And sometimes it's hard, you're understaffed anyway, and it's hard to pull people to travel an hour to the main headquarters for training. You could facilitate that through type of equipment that would establish distance learning too. So just keep that in mind. But the distance learning is not just restricted for education institutions. It's that it has to provide an education from one site to another site. And telemedicine, kind of same concept. It deals with healthcare, where you're going to provide specialty telemedicine services or telehealth through the telemedicine equipment from urban sites to rural sites, or it could be again from rural to rural sites. As long as there's a distance between the two sites, that's what we're looking at for that. So as far as eligibility goes, these are some high points that are normally what restricts applications. If they don't complete these things, of course, we cannot take your application through to the scoring or awarding process for that. So, an application must meet at least 20 points for reality. Now, that is an objective score. You'll understand that before you even file. And we'll talk a little bit about how to approach your application in order to understand how to maybe maximize those points just a little bit later. But at the bottom is the link for the program. Eligible applicants. It pretty much, as long as you're not an individual or a partnership, you're going to be eligible. Okay, you have to be organized within the state
Chris, can you hear me?
Yeah. We had a little bit of a hiccup there. Sorry about that.
Okay, I thought it was my internet. Okay.
Well, I thought it was me. I'll take the blame. Let's see here. Okay, I think you see the slide?
Yes.
Good, okay. So as I was saying, to be an eligible applicant, you just need to fall within these areas. Also, you have to be registered in SAM.gov. You have to have a valid DUNS number. One of the things in SAM.gov, I want to just comment now, when you're doing this, make sure you do all the certifications in SAM.gov. We require that, and if you don't complete those certifications, actually your application can be denied. Examples of eligible equipment real quick. Overall approach this program. This is an equipment program. Okay. Now we can fund some software items. We can fund Zoom. We could fund things like that, as long as it's purchased in a certain manner. But the biggest priority for this program is about equipment. It's not about staff salaries. It's not about anything that doesn't deal with telemedicine or distance learning. This isn't an EMR program. A lot of people try to approach this and say, hey, can I get stuff for my EMR? No, you cannot. So it's primarily equipment for connecting site to site. Here's some resources. And one of the things I want to make sure to highlight here, actually it's on the next page, is email subscription. So I do encourage you to do the email subscription and select DLT, or if you're interested in other items, you can select those as well, because this is how you're going to stay informed of any updates, any changes, and whenever we open the application period, you will get an email notification. Okay, and once the application period does open up, I will schedule and try to maybe work with someone to put on a workshop. Last year I did with Tim Arbeiter. He assisted to get a workshop going. I usually try to have about a 2-hour, 3-hour workshop. I hope to have them in person again soon. But if not, I will attempt a 2-hour workshop online, as long as people drink their coffee first. So anyways, with that being said, again, we'll hold questions till later, but thank you for your time.
All right, everybody. I am going to attempt to share my screen for Richard here. So hold on.
Thank you. And Richard, if you want to go ahead, are you able to put on your camera and unmute?
Well, Maureen, I am. However,
Perfect. Okay, there we go.
I am dealing with a little bit of a back issue, so I'm going to spare you from looking at me laying on my couch right now. So my apologies, everyone.
That works out fine. And your slides are ready. So if you want to go ahead.
Yeah, thank you. And thank you, Maureen. Appreciate the introduction. And Chris, it's good to see you as always. Just quickly want to say thank you to Melissa and the Missouri Rural Health Association. Obviously, wish we could be there. I love Kinderhook and Camdenton, and always enjoy this event every year. So hopefully next year we get to see you all in person. Like Maureen said, I am Richard Overcast. I'm the Deputy Regional Administrator of HRSA's Office of Regional Operation in Kansas City, or Region 7. HRSA, if you're not familiar with HRSA, we're one of 11 operating divisions within HHS. Kim Reynolds, who's here with SAMHSA, is also one of our sister agencies within HHS. And HRSA, just very broadly, we have over 90 programs, and our mission is to improve health outcomes and achieve health equity through access to quality services, a skilled workforce, and innovation through high-value programs. Next slide, please. And so drilling down a little bit further in my office, the Office of Regional Operations, we work across all of HRSA's programs, areas, and we are primarily there to extend the reach of our other bureaus and offices within HRSA to provide an additional touch point for HRSA stakeholders, for all of you sitting in here today. There are 10 regional offices, and we're spread across the nation with the headquarters office in Rockville, Maryland, and we have a sub office in Puerto Rico. And as I mentioned, I currently sit in Kansas City. Next slide, please. So ORO is uniquely positioned in the field to gather and assess ground level intelligence about healthcare issues and trends that impact all of you. Our staff in the Office of Regional Operations, we're ambassadors, providing outreach and education to increase the reach and impact and awareness of those 90 plus programs that HRSA administers or has oversight over. My office, we're really kind of that jack of all trades, and there is no wrong door when you're thinking about working with my office. We can assist with brokering relationships and connecting you to our programs, resources, and just other funding opportunities. And I think that's the biggest takeaway that I have for you today is if your mission, your work lines up, with any of our programs, and you need to have a point of contact to get more information about that program, our doors are always open, and we'd love to work with you in that capacity or other ways. Next slide, please. And so just to kind of give you a sense of what my office does, I want to quickly just highlight a couple activities we've taken part in recently, kind of focused around COVID-19, as we're all laser focused there right now. But we had the HRSA CDC Rural Vaccine Confidence Listening Sessions, and this was a partnership with CDC's Vaccine Task Rural Health Team. We convened 5 listening sessions across the country on vaccine confidence. And really the purpose of those listening sessions were to identify factors that influence vaccine confidence, particularly in rural communities. And we developed recommendations designed to increase that vaccine confidence and acceptance. And we prepared a summary of each session with recommendations to share with our listening session participants, state health departments, and also our state offices of rural health. We worked with our state offices of rural health in selected states to coordinate and host those sessions. We also have been working on the COVID-19 vaccine confidence webinar. This was a collaboration between Region 7, my region, and the Health Center Association of Nebraska, or the Primary Care Association. We hosted it was a second session recently in the COVID-19 vaccine hesitancy webinar series. And again, it focused on building vaccine confidence in underserved communities. It was geared towards health centers and rural health clinics and their staff, social service providers, community health workers, HUD housing service coordinators, as well as faith-based leaders. We had a number of topics that we went through during these sessions. And so, I just bring those two up to kind of show you the outreach and education component of my office and the work that we do. But I want to quickly transition to some of the programs that are out there. If you next slide, please, Melissa. And I want to just, if you're not familiar with, just quickly highlight a couple different program areas, again, centered around COVID. But HRSA has worked extremely hard, as all of our sister agencies and other federal partners, and as all of us are, laser focused again on this issue. But we've worked specifically to ensure equity in COVID-19 vaccine distribution through a couple of key areas. And one of those is engaging federally qualified health centers through the Health Center COVID-19 vaccine program. This was a partnership between HRSA and the CDC. And it began incrementally at select HRSA-funded health centers that specialized in caring for those hard to reach and disproportionately affected populations. The overall focus of the goal was to address health equity in vaccine delivery by providing a direct supply of COVID-19 vaccines to health centers who serve these disproportionately affected populations. We've also recently stood up the expanding COVID-19 response in rural communities through rural health clinics. And this was to expand access to vaccines and ensure equity in COVID-19 response in rural communities. And HRSA is working with those rural health clinics or RHCs across the nation to strengthen vaccine allocation and confidence, and to expand COVID-19 testing and vaccination. So this is really a three-pronged approach in this program to help rural health communities meet those needs and improve healthcare services. That first one, expanding COVID-19 testing and mitigation, also ensuring equitable distribution of vaccines in rural areas. Under that piece of that part of the program, enrolled Medicare certified RHCs will receive direct COVID-19 vaccines in addition to their normal jurisdiction's weekly allocation. And also, through building vaccine confidence, once again, Rural Health Clinic Vaccine Confidence Program will support RHCs to improve vaccine confidence in rural communities where COVID-19 vaccine uptake lags in comparison to some of our more populated areas. It's our federal office of rural health policy within HRSA. They're working on making grants awards to all those eligible RHCs that apply and have a complete and acceptable application. Those applications, the deadline for those were actually June 23rd. Those have been awarded, and money has been going out the door. If you'd like to know where those dollars are going, you can always visit our website at HRSA.gov and find a listing of those grant awardees. And then finally, with HRSA HUD collaboration, the Department of Housing and Urban Development and HRSA, their joint efforts recently to increase access to COVID-19 prevention and treatment services, again, including testing, vaccinations, are among those disproportionately affected communities, primarily among HUD-assisted households and people experiencing homelessness. And so this program has leveraged the Health Center COVID-19 vaccine program, some of those efforts there, but HHS and HUD expect to reach more than 6,000 multifamily housing properties, 67,000 homeless shelters, and approximately 7,500 public housing properties across the country, in order to stop the spread of COVID-19. Next slide, please. The COVID-19 claims reimbursement to healthcare providers and facilities for testing, treatment, and vaccine administration for the uninsured. This uninsured program, it provides claims for reimbursement to healthcare providers, generally at Medicare rates for testing uninsured individuals for COVID-19 and treating uninsured individuals with a COVID-19 diagnosis, and also administering COVID-19 vaccines to uninsured individuals. To date, this program, the Uninsured Program, has paid over 5 million claims to healthcare providers. Black, Latino, and Native American people are, as we know, are more likely to be uninsured. The Uninsured Program, it's a key tool for ensuring everyone has access to COVID-19 vaccines, and that the cost is not a barrier for individuals or healthcare providers. There are approximately 29 million uninsured individuals living in the United States, and this program allows anyone with health insurance or without health insurance, no matter of their immigration status, to receive COVID-19 vaccines for free by reimbursing those providers for their cost of administering the vaccine. It also covers testing and treatment claims for individuals without health insurance. And then finally here, the COVID-19 Coverage Assistance Fund is covering the cost of administering COVID-19 vaccines to uninsured patients. And with this program, the patients cannot be billed directly for COVID-19 vaccine fees. Healthcare providers on the front lines administering the COVID-19 vaccines to those uninsured patients are able to seek fee reimbursements through this Coverage Assistance Fund. Next slide. So the HHS COVID-19 public education campaign here, the We Can Do This, it's a national initiative to increase public confidence in and uptake of COVID-19 vaccines while reinforcing basic prevention measures such as mask wearing and social distancing. This is a nationwide network of trusted messengers and constant fact-based public health messaging. The campaign really helps the public to make informed decisions about the health and COVID-19 and including steps to protect themselves and their communities. So there's a number of free guides, ads, social media, and other materials that are available through this effort. And there's a really rich, full, robust toolkit that can help reach those diverse communities. The effort, it's driven by communication science and provides tailored information for those at-risk groups. And you can use the vaccine hesitancy map to see where people may be more hesitant about getting vaccinated. There's a website there that I've listed. And next slide, please. So as a core member of this program, what you would get if you were to sign up is just a number of resources that would help you to build vaccine confidence in your community, including fact sheets on vaccine safety, social media content to share with your followers, and also regular email updates with the latest vaccine news and resources. Next slide, please. I just quickly grabbed 3 new resources that I've seen recently and wanted to share those with you. One is from our Rural Health Information Hub. It's a toolkit with resources that you can use to respond to maybe local surges and cases. You can at first identify those areas. You probably know that if it's going on in your area, but just a litany of resources there to help deal with those outbreaks. And all those are kind of geared and focused on a rural environment. And then also the customizable COVID-19 vaccine communication toolkit for rural communities and the mobilizing healthcare workforce via telehealth. I would spend more time on here, but I want to make sure my colleague has ample time to discuss SAMHSA projects and opportunities. So next slide, please, Melissa. And so I'll just leave you with looking ahead for the future. We are currently, my office is sitting down and putting together an operations plan. We run fiscal year, so October 1st through September 30th of each year. We are building out the FY22 ops plan as we speak now. So, if you're interested in partnering with us in any way or just finding out more about HRSA's programs, again, I encourage you to reach out to me and let's start a conversation and see where it leads to. Next slide, please. And we'll save questions for the end. One final slide, Melissa. Actually, it's in that slide deck. No need to go back to it, but my contact information and also our regional administrator's contact information can be found in that slide deck. And Maureen, back over to you. Thank you all.
Great. Thank you very much. Kim will go ahead and get started in just a minute with your presentation. Melissa will get your slides up and going. And then we will go ahead and get started. Richard, thank you very much. Chris, thank you very much for your presentation.
I'm working on it. I have to end one and get the other one up. Hold on just a second.
So Kim, while she is getting the slides up, is there an introduction or anything that you wanted to do about yourself that we didn't add in the introduction earlier?
So I'm Kim Reynolds. I'm the Assistant Regional Administrator for SAMHSA, the Substance Abuse and Mental Health Services Administration. You can go ahead and go to the next slide. In Region 7, there we are in the middle of the country. And so like Rich had mentioned, at HHS, we divide up the country into 10 different regions. And so with me in our regional office, and we are an office of 2, is Kim Nelson, our regional administrator. She's another Kim, so it's easy to remember our names. If you can go ahead and go to the next slide then. And so I really appreciate the opportunity to talk with you today about SAMHSA and SAMHSA resources. But before we get started, I want to acknowledge the unique barriers to behavioral health service access in rural areas, availability, accessibility, and acceptability. Go ahead and go to the next slide. And I also want to acknowledge the impact of COVID on behavioral health in these past couple of years. Next slide. And I'll be talking later in the presentation about resources specifically related to rural behavioral health and to the behavioral health impacts of COVID-19. Next slide. To tell you a bit about SAMHSA, our mission is to reduce the impact of substance use and mental illness on America's communities. Next slide. And here are our current priority areas of focus. Next slide. So the first resource that I want to tell you about is actually our website. And there are a number of different things that you can find on it that I'll be talking about through this presentation. Behavioral health treatment locators, grant opportunities, data resources, other kinds of resources like publications and toolkits, technical assistance, and of course, some specific resources related to COVID-19. Next slide. And so here are just some of our COVID-specific and COVID-related resources pictured on this slide. We actually have what we call the Dtac. It's our disaster technical assistance provider who develops a lot of different products and resources related to disasters. I did want to draw your attention to our disaster distress helpline that is pictured in the middle of the screen. It is a 1-800 number that is available 24/7. You can call or text. Anybody who's been affected by a natural or man-made disaster is welcome to call and just chat with someone. Next slide. So the publications that I showed on the last slide, as well as many, many more, can be accessed by visiting what we refer to as the SAMHSA store. We call it a store, but actually everything in it, for the most part, is free for download. So just to know that resource is out there. Next slide. Then I want to also mention our treatment locator. So I gave you an example here of how to use the locator. And so it's a repository of information that providers across the country have provided information to us. We've put it here, and then it has this mapping function. So for example, I put in Jeff City because it was kind of in the middle of Missouri, a distance of 25 miles. I picked all the substance use and mental health providers, health centers, buprenorphine providers. And then as you can see on the map, it locates them. There's also a list then going down the right-hand side of the screen that just shows a couple of the 35 results that were returned. So that's something that anybody can use to find different behavioral health types of services. And there are other drill downs that I didn't use that like type funding source, population, things like that. So that's an effective way to find resources in your area. So next slide. I also want to mention that we have multiple sources of data from grantees, including states and tribes, and from other surveys. The survey that we talk about probably the most is the NSDA, the National Survey on Drug Use and Health. It's a rich source of behavioral health data on folks 12 and older, and it's available at both the national and state levels. Next slide. And on this next slide, you can see an example of just some of the data. It's a very rich data set that gives information both nationally and at the state level, like I said. Next slide. So we're also a grant making agency. As you can see, our base budget has risen annually and in recent years, and then was more than doubled by COVID supplemental and American Rescue Plan funding. Next slide. We provide grants. We provide formulary grants to states and tribes. It's based on a formula related to population and a variety of different factors. Next slide. And then we also have a number of competitively awarded grants. And here's just a list of some of those to give you sort of a sense of the types of grants that we fund. Next slide. If you want to learn more about the grants that we fund, you can visit the grants portion of our website. You can sign up for email updates and view an applicant webinar about kind of, how to apply. In addition, if you go to the grants.gov link that's on our website and search grants and then select SAMHSA, right now, if you did that, you'd find 17 grant opportunities that are planned for the next fiscal year. They're what we call forecasted. They're not posted. You can't apply for them. They could change or be withdrawn, but for the most part, they're going to be part of our next year's budget. And that's just a place to go to find current grants as well as closed grants as well. So next slide. I want to briefly mention our rural portfolio. So the Regional Opioid Technical Assistance Program, which is a partnership between SAMHSA and USDA, provides funding to develop and disseminate training and technical assistance for rural communities on addressing opioid and stimulant issues affecting their communities. And so one example of the work of the regional ROTA, which is Iowa State for our region in Missouri, is their support of an initiative called Recovery Friendly Workplaces. So this is a project that fosters a workplace culture that promotes employee safety, health, and well-being through strategies that provide support for managers and employees, including reducing stigma and providing recovery resources related to the challenges surrounding substance use disorders. So next slide. I also want to mention our Rural Emergency Medical Services Training Program. So the purpose of this program is to recruit and train emergency services personnel in rural areas. And so not only does this program serve to increase the number of EMS personnel, but also to ensure that they get training on behavioral health disorders and how to care for people who are having, behavioral health disorder emergency situation. So in addition to recruiting and training new EMS personnel, it also funds the development of new ways to educate emergency healthcare providers through the use of technology-enhanced educational methods and assists with the acquisition of PPE for emergency personnel. And so if you're interested in potentially applying for this program, it is one of the 17 forecasted opportunities you could go out and look at. Also, we've included a map with some of our grant recipients. And next slide. Then I also want to mention that we provide significant training and technical assistance through a variety of different contracts. One is with our Technology Transfer Center network in our region. And in every region, we have an A, an MH, and a P, an addiction, a mental health, and a prevention technology transfer center that has just many things: webinars, toolkits, fact sheets, training, and technical assistance that is available for anybody to access. I specifically wanted to mention on the slide, I have a link that they have created some resources for folks who have anxiety around returning to work and school post or during the pandemic. And next slide. In addition to our TTC network, we also have a number of different TA centers of excellence on a variety of different topics that, again, anybody can access: webinars, toolkits, so many different resources that they have archived out there. And so then finally, the last slide, just my contact information in case you have any questions or want to learn more. So thank you for the opportunity to talk with you today.